Indigenous communities in regions 1, 2, 6, 7, 8, and 9 are welcoming support from the Amerindian People's Association, APA, during the COVID-19 health crisis. Over the last few weeks, representatives for the association has been traveling to communities despite the bad weather and terrain to distribute medical and food supplies to these communities. With Santa Rosa Maruca in Region 1 recording a number of cases due to poor testing, the association is calling on the Health Ministry to conduct more testing in the other communities. Executive Director Jean LaRose, during a virtual press conference on Monday, highlighted that letters were sent to the National COVID-19 Task Force for support during this time, but have so far gotten no response. As such, the association redirected $29.5 million from other projects to assist the communities.
But I can't overstress the need. Need in terms of the PPEs, need in terms of sanitization, need in terms of beds, need in terms of quarantine facilities, needs in terms of increased human resources. Santa Rosa started out with very low number of doctors and other medical personnel in the community. Now the number has increased.
The association in its COVID-19 response is also targeting farmers and fishermen. The association at this time have not arrived at a position to identify the full impact on Indigenous communities, but noted that immediately the education and health sectors are most affected.
Immediately the impact would be on health, of course, because it's a virus, a pandemic we're dealing with. So immediately the impact would be on health and the ability or the capacity of the various communities throughout Guyana's hinterland to deal with the health issues confronting them. We have seen the case of where I would say all of these communities have been unprepared to face a situation like this. Many of them had no PPE to start with, sanitization supplies they did not have. Basic over-the-counter medication ran out very quickly in some cases, or in some cases they didn't have any to start with.
It was highlighted that the business community has also been tremendous in providing the association with discounts on food supplies and transportation costs for distribution. The executive director further said that mental health must be looked at with some form of urgency during this time.
Many of the families in Santa Rosa that I know who were in isolation or who are in quarantine, husbands, wife, children, teachers, all have some story to tell about being traumatized, mentally traumatized. And I think that aspect of COVID is not being looked at when it comes to the communities.
The association further pleaded that the emergency measures and curfew not be lifted as soon as there are no new reports of COVID-19. In addition to the distribution of food and medical supplies, the association has also been campaigning on the dangerous effects of COVID-19 in the communities. However, some residents are still challenging the efforts and claiming that the virus does not exist. Reporting for the newsroom, I am Isanella Patwo.